We are starting this conference, 21st India Policy Forum, with lamp lighting, which Dr. P.K. Mishra, Mr. Nandan Nilekani, Ms. Rohini Nilekani will do, so please. And after that, Mr. Nilekani will invite Dr. P.K. Mishra to inaugurate the conference.
I'd like to request Mr. P.K. Mishra, Principal Secretary to the Prime Minister, to join us on stage. I'm really delighted that Mr. Mishra is here. He's been a big supporter of the work we do at NCAER. I've known him for more than a decade, and he's been very, very supportive. So it's a busy time, as you can imagine, for him, but he found time to come and be here. So as Poonam mentioned, this is the 21st session of the India Policy Forum. It's been on for 21 years. In fact, it was started when Suman Berry was the head of NCAER 21 years back. And over the last 21 years, it's become a great convening place for policymakers. More than 100 papers have been published, good papers as part of the IPF. And this has been on very diverse topics. The other thing about IPF is that it convenes a very diverse set of people. It has obviously people from academics, we have people from many global and Indian universities, we have people from government like Mr. Mishra and many others, we have people from the private sector, we have policymakers. So it's really a very diverse group who get together for these 2 days. And this time in particular, we have a very, very interesting agenda. It covers the digital transformation of India. It covers the issues of state finances, which is very timely because of the formation of the 16th Finance Commission. In fact, Mr. Arvind Panagriya will also be here, and there'll be a discussion on state finances, as well as another discussion on Punjab and Punjab state, and Vinny is here. So I think it's going to be interesting discussions. We also have discussions on social security net and global labor mobility. Lant is here. So it's really many diverse things, and we have, I think, a very good plan. We are also trying to make sure that we have a lot of time for interaction among all the participants. So we have a big program today and tomorrow. So let me say that this is something which is very important because there are not too many of such gatherings. We like to believe we are the best think tank in India, but I know Deepak is here, he may not agree. So I don't want to get into some marital squabble on this. But we think they're the best think tank in India. And I think, as you can see from the quality of people who are here, that this is really something very special. So with that, I'd like to request Mr. Mishra to say a few words.
Sri Nilekani, Dr. Poonam Gupta, and distinguished participants, it is a great opportunity for me to meet all of you here. In fact, this is my first visit to the new building of this National Council of Applied Economic Research. Many of you, of course, I know. Some others I may not be knowing. But I have heard a lot about the Institute. I have seen many of those important publications also. Of course, we have been interacting with Dr. Poonam Gupta also as member of the Prime Minister's Economic Advisory Council. and all others. Mr. Nilekani, of course, very well known, and we have been interacting on various other issues. But I didn't know that he's chairing this for last 1 decade. And there are very interesting papers. And the first session, of course, is also very interesting. And it is a privilege for me to inaugurate this important policy forum. I am told that this is being held for the last 21 years, and which is really a very, very important milestone for the country's economic thinking. Economists and economic ideas, of course, have been very important right from independence or even before. Of late, of course, there are a lot of questions being asked about economic research, particularly with the development of technology, with the development of various uncertainties and geopolitical tension. Some of the conventional economic ideas and assumptions are being questioned. I am sure policy forums like this can help us how the economic ideas can help the government, policymakers, and others in navigating through this increased uncertainty, increased risk, and of course the very great advancement of technology, which is changing the way our life and the way of our working. So with all this, with all this, I think it is, okay. With all this, I think once again, I thank all of you, Dr. Poonam Gupta, the NCAER, Mr. Nandan Nilekani, and I wish the forum all success. Thank you. Participants to this first session of the Policy Forum. I would like to thank Dr. Poonam Gupta and NCAER for inviting me to this forum. And I understand that a paper will be presented by Professor Sonalde Desai and her team of the NCAER. And I am sure it will be a very, very insightful paper on rethinking social safety net in a changing society. The paper is based on the India Human Development Survey, which is being held for the last 20 years. And it is interesting because I had a chance to go through the paper. It's a very interesting paper because at 3 different points of time or different periods, they have studied the different types of the socio-economic aspect of the families, about 40,000 families, I am told. This, I look forward to this presentation because there have been some of the earlier studies also, the longitudinal study, particularly a village, Palanpur village of Moradabad district of Uttar Pradesh. There is a recent book, recent means in 2018, How Lives Change, Palanpur, India and Development Economics, by 3-4 authors, including Himanshu and I think Nicholas Stern and others. That was, of course, continuation of an older study by Bliss and Stern on that same Palanpur village that was published in 1982, and this was in 2018. So all these bring out how things have changed, the socio-economic life of a particular village has changed, how the non-farm sector. ICRISAT also earlier were doing such longitudinal study. I had interacted with them in 2007 or 8. I am not sure whether those studies they have continued. But this study will be very interesting because this is based on very recent data. Of course, the issue of chronic poverty and transient poverty have been researched for quite some time. A book of 1993 edited by Michael Lipton brought out extremely relevant aspect of measurement of poverty, events affecting poor, how the transient poverty and chronic poverty can change, and of course experiences of different countries. So I am sure this paper will add great value to the study of poverty and how things have changed with this recent changes in socio-economic aspect. So may I now request Dr. Desai to present her paper.
Thank you, Shri Mishra, Shri Garg, Professor Devarajan, and esteemed guests. It gives me great pleasure to present the early results from India Human Development Survey. We just finished our field work on June 15. So this is going to be a very simple analysis that I'll be presenting. And in a way, I'm relieved that I'm not going to be presenting any econometrics, because with Lant and Karthik in the room, no econometrics would survive. So all you're going to do here is some very simple story, but hopefully relevant to the kind of discussion that India Policy Forum would undertake. First thing I want to do is, though, acknowledge my colleagues at NCAER and University of Maryland. I'll tell you a little bit about this study in a few minutes, but this is a panel survey that was started about 20 years ago, and continuing it has been a leap of faith. It's a leap of faith, sort of knowing that, we will somehow make sure that it gets done, even at times when there wasn't, funding was an issue, when we were worried whether the respondents will want to talk to us or not. I remember at one point when we were between the funding rounds, we historically sent out a greeting card every year to our respondents. Now, sending out 50,000 greeting cards is a pain in the neck. And I was talking to some of my colleagues and I said, well, I don't know, we'll have the money for the next round. Should we be doing it? And O.P. Sharma, who is our field coordinator, said, no, we are going to get the money. Somehow we have to do it, because otherwise it would look to our respondents like we are matlabi. We only come to you when we want the data. Okay? We somehow have to stay in touch. And that has been the spirit with which this work has been done. So let me tell you a little bit about the survey, and then I'm going to jump into the substantive part of it. Okay? The survey started in 2004-05. We have done 3 rounds of it. It's a nationwide survey with over 40,000 households. The current round is actually 47,000 households. We do interview the same households time and again. When households split and live in the same area, we would interview both the splits. This time, when people migrate, we actually try to interview them by telephone to catch as many of the migrants as possible. We see what we do as a supplement to major data collection efforts like National Sample Survey, National Family Health Survey. It is not designed to replace it. Our advisory panel was chaired by Pranab Sen, and Pranab Sen kept telling me repeatedly that you should not be aiming to provide estimates of any indicators. What you are really talking about are processes, and I think that's where we stay with. In general, we try to have comparable questionnaires in all 3 rounds, and what I'm going to present today would be very much on the comparable questionnaire. Our strengths basically lie in providing insights into poverty dynamics over time. Okay, thank you. So IHDS was done at 3 points in time, 2004-05, 11-12, and the last round was 22-24. It has over 40,000 households, and in general, they are pretty much the same questions, but the last round was digitally collected. If you compare it to national sample survey, which they just brought out the new round of a household consumption expenditure survey, which is a much larger sample, over 250,000 households, over 405 items of consumption durables when we only have about 53. So I think that if you are looking for anything on the estimates of poverty, stay with National Sample Survey and their information. If you are looking at sort of poverty dynamics and changes, then IHDS has something to offer. We also have some shortcomings that I just want to make sure are brought out upfront. Specifically, in any panel study, you lose people at times. So between wave 1 and wave 2, we had attrition of about 17%. Now we have between wave 2 and 3 an attrition of 19%, although we did recover some of the wave 1 households. And I'm not that worried about attrition in the sense that what we did do is we added some of the households in the same neighborhoods. What is a problem really for IHDS is that the sampling frame relies on 2001 census. And the new areas which have grown up, your Noidas and Gurgaon and so on, we don't always cover. So in that sense, it becomes somewhat of a selective sample. So it has a different sense. It's different strengths from the NSS, NFHS, and other surveys. But over time, looking at the same households offers some very interesting insights. So here are the 5 stylized facts that I intend to present as we go along. First, I'd like to tell you that at least by our data, the poverty has declined substantially as it has through other sources of data. Second, over time though, the role of transient poverty, where people get pushed into poverty, they move out of poverty, they fall back in, has become more important than the nature of chronic poverty that we historically used to look at. Third, food subsidies have increased in size and amount and coverage, and they have generally been pro-poor. Other benefits have also increased, and in some cases they have been pro-poor, in some cases they have been sort of more evenly distributed. Finally, perhaps the most controversial point to make here is that identification of poor through proxy means testing is imperfect, and that imperfection has to be taken into account as we think about developing safety nets. Okay, the first one, poverty has declined substantially. This is basically, I'm showing you consumption distribution from IHDS survey. As I said, we ask for consumption distribution for the items which are roughly about 53 items, which were sort of based on some of the early NSS survey. When we started, we wanted to collect data that we could benchmark ourselves against to see the quality of the data we were collecting. And at that time, the Employment-Unemployment Survey of NSS had this shorter consumption module, which we copied verbatim. And so we have used that over time, and then we have kept it consistently over the 3 time periods. For those of you big into poverty research, this is basically mixed recall period, whereas the latest NSS round tends to be modified mixed recall period. What you can see is that on one side, I have the panel households plus new households. So we periodically add new households to refresh our sample. And this time we have added roughly about 7,300 households. So the one side has the consumption expenditure distribution in 2024 prices for each of the 3 rounds. For the panel and the new households. The other side is only the panel households. And the 2 dotted lines you see is, one is sort of approximate poverty line, Tendulkar poverty line, which has been updated to 2024 prices. And the second one is double the Tendulkar poverty line. So I'd like to talk about sort of the poor and the vulnerable between the 2, Tendulkar line and double the poverty line. And I'll consistently talk about these 2 groups as we sort of go along. And what you can see is that the consumption expenditure distribution has shifted to the right, supporting the findings from other sources as well, which shows a decline in poverty and growth in consumption expenditure. exact estimates of current level of poverty will vary based on data collection methodologies. No two surveys are going to look exactly alike. IHDS is more conservative than NSS because IHDS sample excludes the newly urbanized areas. Okay? But even with these conservative estimates, we see a substantial poverty decline from 39% in 2004-05 to 8.5% in 2022. This is using the Tendulkar poverty line, which has been updated. Okay? What is more interesting is to sort of look at not just the poor, but the people just above the poverty line, because those are the people who are going to be of very great relevance for future policy discourse as we go along. And what we see is that there is a movement where over the 3 survey periods, the headcount ratios of people under poverty has been declining steadily. People under the group that is sort of vulnerable has stayed more or less stable with some decline. Okay? And then people have moved out of poverty, who we call non-poor. Okay? So in some sense, as we think about future of India's social policy, it's not going to be just the people who are under poverty, but it's going to be people that sort of this big bulk of people under poverty and just above that poverty line. Second point I'd like to make, and this is where actually the panel data is useful, which is that over time, accidents of life in pushing people into poverty has grown, whereas accidents of birth have declined. Okay? Which is basically, accident of birth is what I'd like to talk about as sort of a chronic poverty. You know, you're born in poverty, you're either coming from scheduled caste, scheduled tribe, living in some of the poor districts, and those are the areas which are poor, groups that are poor and remain consistently poor. And then there are people who have kind of moved out of poverty, but they're just one illness, one pandemic, one accident, something away from falling back into poverty. Okay? So these are the 2 categories. Here, what I show is the transition between IHDS wave 1 and 2. So what you see is that basically people who were in 2004-05 poor and non-poor 2 category, some of them moved out of poverty, some of them remained poor. Some of the non-poor became poor and others remained non-poor. So it's these 2 red boxes, the 13.3% plus 8.4% are the people who are poor in the IHDS wave 2. Okay? And we want to compare the proportion who are sort of chronic poor versus transient poor, people who became poor versus people who were poor and remained poor. Now, Shri Mishra talked about Lipton's book, and I think some of the earlier work that has been done in India showed a very strong persistence of chronic poverty using data from 1970s, 80s, and 90s. What I'm about to show you is actually that chronic poverty is declining, at least using this definition. So, if the below poverty line cards were given based on 2004-05 poverty status, in 2011-12, we would have missed out about 40% of the people who became newly poor. By the time you come to the more recent period, if we had given BPL cards based on 11-12 status, we would have missed out actually 60% of the people who are currently poor. So what is happening is that now transient poor has become a much bigger segment than the chronically poor people. Okay? Now, again, I have to say that this is based on this current definition that I'm using, which was the old, which is the definition that was adopted by Planning Commission about 12 years ago. I assume there will be at some point some reformulation, but given that particular definition, what we are beginning to find is that people falling into poverty is a proportion that is increasing. And that's the proportion we need to pay attention to. Okay? And in some sense, we start thinking about safety nets. Our rethinking of safety nets really needs to account for this vulnerability, not just the chronic poverty. Okay. Now, our traditional approach of identifying people who are what we call BPL, below poverty line cardholders. In recent days, we are using the word priority households. Okay, this traditional approach has basically relied on doing surveys every 10 years. Now, actually, last survey was in 2011, so quite some time ago, where we basically count every household and identify them based on certain criteria of deprivation, ownership of goods, etc., rank them on the sort of deprivation status, and then apply a cutoff to define somebody who is a below poverty line household. Okay? Now, if things are changing very rapidly, then this every 10-year identification is basically going to become very quickly out of date over time, and I'd like to show you that it is actually happening. Okay. Now I'll change the topic a little bit and talk about some of the recent safety nets which have been very important in the current era. One is that the food subsidies have grown over time. They have grown pretty steadily from 2004-05 to 11-12 to 22-24. Okay? However, the big change that occurred following the National Food Security Act of 2013 was that now the subsidies are really focused on food, and the kerosene and sugar subsidies have gone down. So the proportion of households which are relying on a public distribution system to get subsidized, highly subsidized, in many cases practically free food grains, has increased quite a bit. According to the National Food Security Act, 75% of the rural households are supposed to get these subsidized grains, and 50% of urban households, so bringing total India overall about 60 to 66% households should be getting those grains, and in fact they do. Okay? Imputed subsidies, which is basically calculating the price paid at the public distribution or ration shop versus what the market price their neighbors are paying in the same area, has also grown over time. Including PDS subsidies in our poverty calculation further reduces the number of people under poverty. Okay? And proportionately, the impact of the PDS subsidy on headcount ratio of poverty has grown in recent period, largely because the number of people who are covered by it has grown, and it clearly seems to be somewhat pro-poor, given that it has an impact of reducing poverty rates. Other government benefits have also expanded. And this expansion is vast, actually. Okay, I was surprised by the numbers that we were seeing. Okay? In rural areas today, in 2024 prices, an average household is getting roughly about 6,000 rupees. So what we had done was we had asked, what are the kinds of benefits that you've received in last 12 months? Old age pension, widow pension, maternity benefit scheme, PM Kisan, the farmer benefit scheme, and so on. And those numbers are fairly high. Urban areas, the subsidies are lower, fewer people are getting it, largely also because the big subsidy is really coming in the form of the PM Kisan, the farmer's cash subsidy, which the urban residents are not eligible for. Okay? But still, the numbers are quite large. Distribution of government benefits by household ownership of consumer durables. So what I wanted to do was to look at whether these benefits were pro-poor or not. Okay? Now, one of the problems with respect to looking at the impact of any benefits on pro-poor versus not is that the benefits that are received are used for consumption, which itself boosts up your consumption expenditure. And especially when you are getting large cash inflows, okay? People may start buying a variety of the phone that they badly needed, they might buy. Okay? And so there is an endogeneity in your household consumption expenditure to the benefits. Okay? So one thing I tried to do was look at the economic status of the household in the previous wave. Now, the fact is that 12 years is a too long a time to be looking at it in terms of previous wave, but nonetheless, it seemed somewhat more appropriate than looking at absolutely the current economic status. following absolutely fantastic paper by Lant and Dion Filmer, where they talk about measuring consumption without tears. They have talked about using consumption, sort of household ownership of assets, phone, cot, clothes, refrigerator, etc., as a marker of household economic status. And we focused on that because our research also shows that consumption expenditure is a little more volatile than these asset ownerships. And what you see is that in rural areas, there is a somewhat of a concentration at the top of the consumption expenditure in terms of benefits, largely because of the farm subsidies and the farm ownership at the upper end. Okay? In the urban areas, it's much more concentrated at the bottom of the consumption expenditure distribution. Okay? The final point that I'd like to make, and this I believe is perhaps the most controversial of everything that I'm trying to present, and I think good people can disagree on each side of it, okay? But at least I'd like to throw it out as a discussion point for us to at least think about, okay? I think the identification of poor through proxy means testing is imperfect at best, okay? Basically, following Akerlof, I think we have all gone into this belief that let's design the best proxy means test to identify the poor, okay? The problem is this, okay, that if the economy is more or less stable, okay, you can probably identify a good proxy means test. Even there, I have some doubts, okay, because you're going to go and ask the households, what do you own, and they know that BPL card is going to be based on it. Who knows what your response is going to look like. But even if it was a most perfect, accurate response, okay, by the time 12 years have gone by, okay, that's going to be sort of imperfect. But things would have moved, people would have moved away from it. Okay. So let's take a look a little bit at, how we have been doing on it. Okay. So right after the 2011, in 2011, a big socioeconomic caste census was had taken place. Its local vernacular parlance, it gets called SECC, where every household was asked, what do you own, what's your caste, who lives in your household, whether there is a disabled person, etc., etc. Based on that, households were ranked in their deprivation status. And each state was given a particular quota based on their poverty estimates of how many people can fall within this deprivation criteria. And then those people were given what was called below poverty line cards. Okay? In recent years, we tend to use the word priority household cards. Okay? There were a couple of other programs which are also designed for very poor, Antodaya, Anna Yojana, Annapurna, and I have clubbed all of those together to identify what government has identified as the households in greatest need. Okay? And then looked at what has happened to those definitions over time based on the consumption expenditure criteria that we can currently see. So compare the rural poor, the vulnerable and non-poor households, and see what percentage of them have these BPL cards. What we see is that there has been a massive expansion of BPL cards that have been given out, which was a function of the National Food Security Act. It was by design. Okay? So there was a massive expansion of the BPL cards that were given out between 2004-05 and 11-12. And then also actually even a much bigger expansion between 11-12 and 22-24 because the NFSA was passed in 2013. But when you have that massive expansion, you think that it should cover at least all the poor households, right? Okay, some non-poor households will have it, but every poor household should be covered by that particular card. And what we see is that they don't, okay? In fact, the increase in the BPL card ownership was bigger in terms of percentage points for the non-poor households than it was for the poor households. Okay? So clearly what's happening is that we are leaving out about 30% of the poor, about 35% of the vulnerable from this BPL card ownership, whereas of the non-poor, about 56% own the BPL card. So it's very clear that our ability to identify people through these BPL surveys is imperfect at best. it has great consequences for other safety nets, okay? For example, what I'm showing you are example of two particular schemes. One is the National Old Age Pension Scheme. In order to get it, you have to actually produce a BPL card, okay? There are some other criteria that can be used, but basically it's the BPL card, which is the major criteria. Similarly, for Ayushman Bharat insurance, again, there are other criteria, but the SECC criteria are the sort of the key criteria to it. So what happens is that among the poor vulnerable households who have a BPL card, 43% have access to the Ayushman Bharat card, whereas among the poor and vulnerable, but you don't have a BPL card, your Ayushman Bharat access is limited to 25%. So using those BPL cards to identify the poor and provide a variety of other benefits tends to be not necessarily the best way of reaching the poorest. This is just sort of a graphic explaining what the Ayushman Bharat card, how it is given and so on, so I'll pass over that. Okay, the alternative might be, can we instead use the universal programs like MGNREGS? Okay, to target benefits. Basically, that's natural targeting. For our guests, MGNREGS is the jobs program where each rural household can demand up to 100 days of work and get it. It will be manual labor, and the expectation is that people who are well off are not going to be wanting to dig the ditches. Okay, so there is a natural targeting in there. Well, it turns out that if you actually look at the pro-poor nature of the MGNREGS targeting, over time it has become much more focused on the middle rather than the poorest. This is kind of interesting because I have done actual evaluation of the MGNREGS from 2011-12 data, and I came out with phenomenal appreciation for the program design, program impact, and its effect on household well-being. So I was personally surprised to see why we are seeing now sort of this middle class or middle income segment use of MGNREGS. Turns out that there is a sort of a key to it. Okay? What has happened is that the use of MGNREGS has increased in South India rather than in the northern plains, which are the poorest ones. So if you look at the distribution of household consumption, asset quintile, it is more sort of shifted towards the southern India. Southern Indians also are more likely to be using the MGNREGS. So yes, there is natural targeting within a region, okay? But the regions differ in their economic status, and so ultimately what you're doing is when you're looking at it at a national level, it ends up being used much more by the middle income category. Okay? So there are some issues with, so what's happening here, okay? Now, that actually, it's a very complex story. I'm not going to be able to tell you in the 3 minutes that are left to me, but I will tell you that there is, I have personally come to believe that the NREGS program design was extremely prescriptive in what could be done with the funds and how they could be spent. They would have worked out beautifully if any of the governments under which this program was implemented had fully funded it. But from its inception, the program has never been fully funded. When it is not fully funded, and you have this incredibly prescriptive nature to the program design, it gets used by people who are able to utilize it the most. And often it tends to be the southern states who are able to bear some of the upfront costs and then come to the center for reimbursement. And there are a variety of other complicated design issues involved in the whole process. So, what does it mean for designing the safety nets? Well, I think to building any safety net program, we need to keep two things in mind. One, poverty is dynamic, and it introduces certain uncertainty in targeting, so we have to take into account that uncertainty. The second part of it is that I think that there is a changing economy and there are a bunch of implementation difficulties. Okay? I think all of us social scientists love to talk about political economy, and I think we would have all, I mean, I have written papers on elite captures, others have written papers on elite captures, but often it is not the elites taking advantage of the programs. It's just that you have designed program in such a way that it sort of relies on outdated data, and there are some natural consequences which sort of play out in perverse ways. So what do we do? I think I would like to suggest that we have to think about three things. First, we have to think about universal program for a limited set of basic safety nets. Okay? I mean, we do it on education and health and food grains as we are doing, but it has to be very limited in terms of the number of items that we are sort of trying to cover, and it has to be more or less universal because targeting is not going to work. Okay. Second, I think falling into poverty is often associated with certain risks that households face. Illness, pandemic, flooding, earthquakes, and so on. Okay? And those are the things for which we need to figure out how to deal with risk insurance. For individual catastrophes, you can have individual risk insurance, but when it comes to group catastrophes, we will need to think about it differently. Because historically what has happened in India and everywhere in other countries perhaps, that we rely on our friends, neighbors, relatives for support when somebody falls sick, when a job is lost. But if the whole village, the whole district is affected by flooding or drought or earthquake, what do? Okay? At that point, the only thing we can do is to provide cash subsidies to pretty much the whole population of the area. Unfortunately, we have no way of getting money into the bank accounts of the people based on the targeted region. And I may well be wrong, so I look forward to, Shri Garg and Nandan correcting me. But my sense was that some of our linkages are set up, are not very well geographically targetable. Okay? So to think about a geographic targeting would be very useful. To give you an example of the need for registries and linkages, is that when during pandemic, US government wanted to send out $600 checks and for people to increase consumption, they could only send it to people whose bank accounts were linked to their tax returns, and the bank accounts were linked to tax returns for people who were getting a refund. Okay? People who are not getting a refund were much delayed in getting those checks. In India too, we send out money to PM Kisan, whereas actually the real need was in urban areas where the effect of pandemic was much greater. Okay? So thinking about social registries might be something worthwhile. And finally, okay, I'd really like to advocate building in flexibility in program design. Something happened to the Indian public discourse in early 2000s where we sort of started focusing on rights-based programs. I think rights-based programs are fantastic, okay, as long as they can be fully funded. Okay? When you cannot fund them, the minute prescriptions of MG and REGS, okay, are actually creating certain perverse design issues. Okay? Similarly, I think that programs need to have a sunset clause because there is a tremendous political risk to discontinuing any program. Over time, we'll want to change the milestones. Okay? For example, the maternity benefit schemes have been very successful in getting hospital deliveries. Okay? Now hospital deliveries are ingrained. Okay? Let's move the milestone and let's make sure that antenatal care and postnatal care are also included. Okay? So if we wanted to do any programmatic changes, okay, it can be done more easily when programs have to be reauthorized or to be sort of reevaluated at the end of a particular period. With that, I'm going to end here and turn it over to the chair and to the discussants. Thank you very much.
Thank you, Professor Desai, for an excellent presentation. A very evidence-based analysis of how chronic poverty, as it gets reduced, the transient poverty dominates. And also you have said that how we need to address poverty and poor people when the circumstances change or the poverty declines, our policy measures need to be recalibrated. Interestingly, the survey which you had analyzed, though based on limited data, but the findings seem to be almost close or corresponding to the household consumption expenditure survey also, because recently a paper written by C. Rangarajan, there they have, I think it was published in Hindu in May 14. That paper showed that based on the household consumption expenditure survey, that poverty ratio had declined from 29% in 11-12 to 10% in 22-23. So that is closer to your 8.5%, and if you have the imputed value of the benefit, then it is lower. Of course, Dr. Saurabh Garg will deal in detail, I am sure, with the household consumption expenditure survey, but it has also brought out very interesting results, like the monthly per capita expenditure has increased in 2022-23 by 40% in the rural area and 33.5% in urban areas compared to 11-12. Similarly, there is decline in the urban-rural divide also, from from about 84% to about 71%. So all these show that there has been reduction in poverty, the chronic poverty, but as you have rightly brought out, the transient poverty needs to be addressed. And some of our the social protection, how it should change, that question you have raised. Some of the schemes which are being implemented now, they are trying to cover all those who are eligible, what is called the saturation approach. I think that to some extent addresses the concern which you have expressed, and I am sure Saurabh Garg and also Professor Devarajan will also address some of the issues which have been raised. May I now request Dr. Saurabh Garg to give his comments.
Thank you, sir. And I must, at the beginning, compliment Professor Desai and her colleagues for an excellent analysis of the data that they have. And I can only quote that I'm not here to bury Caesar nor to defend him. So, but I'll present what I think is a possible way forward and what the thinking on social safety nets is in the different programs that we have. Just to highlight a couple of points from the recently household consumption expenditure survey, and I'll focus on the right side because the left side is just a straight GDP per capita, which shows a constant increase if we look at it over the past few years. In the monthly per capita expenditure, which has come out in the CS of 22-23, for the first time, we also did an imputed calculation of the benefits that are flowing to people. So apart from the left side is a non-imputed and the right side is the imputed one, in which an estimate of the food and some of the non-food items which are given free or nearly free, the non-food being things like school uniforms and cycles and laptops or tablets. And if you see there is, and obviously the imputed one is a slightly higher MPCE, but what I really want to mention is that even after we taken the imputed, we have not included the free health and education that people get. And that the reason for that is it becomes difficult to monetize and determine what should be the imputed cost. But I just want to mention that health and education, which is free, is not included, and therefore the MPCE, even the imputed one, is conservative to that extent. In this, this is from the PLFS survey, the labor force survey that we do. Just want to highlight that if you look at the unemployment rate in the rural areas, whether you look at male, female, or overall, it's all below 3%, whether you call it the natural rate or steady state of unemployment. And that shows that there are no people who are seeking employment, they are not getting employment. And I think that's a very, very important finding that comes out from this PLFS survey, and that perhaps which was mentioned in Professor Desai's also study in terms of the number of subsidies that are increasing at the local level. And the last point, which I will take from the HCCS, is the fact that the percentage share of non-food in the total monthly expenditure is increasing. And it's increasing secularly if you look at the past 20-year data. And that's also an extremely positive trend, that the proportion of food as a total of total expenditure is really decreasing. Keeping all this in view, I'm not getting into further details on the HCCS, but what I just want to focus, which is also Professor Desai's, what is the implication for social safety net programs, and that's what ultimately we're talking about. And in the HCCS, we have the fractile distribution of income across from the lowest 5%, 10%. I'm not getting into that debate on how to define the poverty lines, but there is enough data going around now in the latest survey to be able to look at the lowest fractile. And as was mentioned by Dr. Mishra, that 8% is one estimate, 10% is one estimate. If you look at the lowest fractile of 5% that in HCCS, that income levels have increased of the lowest fractile from the previous. So I'm not getting into the calculation of the poverty lines, but what the focus is to address is on well-being of the people, and that's what most of the focus is there. I'll just give a snapshot of the social safety nets which exist if you take the life cycle approach from 0 to 60 plus. And I will spend a bit more on each of the groups that we have out here. So if you look at the early life interventions up to 6 years, the focus is on the Saksham, Anganwadi, and Poshan, where it's just not nutrition, but also Padhai Bhi, Poshan Bhi. So that's the focus, and it's the numbers that I want to mention, and that's the saturation approach which the government is following. And the saturation is that there should be that minimum basic needs should be available to all, irrespective of their income levels. And the Indradhanush is on the immunization, and you have the intensified mission in the IMI, which focuses on all vaccines. And the Saksham Anganwadi has taken into account that a large proportion of the mental growth is from 0 to 2 or 0 to 6, and therefore the focus on early childhood and education. The PMM Matra Vanda Yojana, which talks on the wage loss during pregnancies. The Vatsalai, which focuses on what Professor Desai mentioned about the transient nature of that people, children who might move out or get into vagrancy at various levels, and focusing on that. And obviously increasing women's participation in labor, which is the Palna scheme, where you have daycare centers and creches across the country, and this is a major focus. And the impact one can see in terms of the progress that's been made over 10 years, whether it's in terms of the sex ratio, in terms of the institutional deliveries, or looking at how the various stunting, wasting, and underweight have reduced. If you look at the 6 to 18 years, you have the focus obviously is on ensuring that the children are educated, because that's where beyond 18 years then there would be issues on their income levels. And the focus is on universalizing access to school education. And I think we've come to a point that we are now focusing on specific groups, whether it's the economically weaker sections, whether it's the SCs and STs. We've now reached a stage that SCs and STs, scheduled caste and scheduled tribes, if they're getting into higher education, we are in a position to provide scholarships to all, so that economic means will not be a reason for them not being there. And also this PM Shri, which has been started to ensure quality education, develop role models in every district, every area, so that they become as magnets for ensuring that overall education levels increase. And of course, the gross enrollment ratios have increased, if you look at, and the focus is on ensuring that there are no dropouts of children when they're moving from primary to elementary or secondary education, or to secondary and post-secondary education. If you look at the major, in terms of the focus, the working age population, I'm not talking of the subsidized free food grains, which has been mentioned, but I want to mention this one nation, one ration card, which enables a migratory labor. Their family might be staying in a village in UP, Bihar, or any other place, and they are working in Delhi or Bombay. So two people can withdraw their ration cards in Delhi and the balance family in their village. And that's really one of the means which has ensured that minimum food levels are available. NRLM is something which has done a revolution in terms of the self-help groups for women, which is ensuring that microcredit and improving the quality of life for them. The Kaushal Vikas Yojana, Manrega, I'd just like to mention that the focus is on ensuring that anyone who is wanting wage labor should get that wage labor, and that's what shows the 99.74% fulfillment. And I would also like to mention that the number of fake job cards that have been removed by ensuring that people, through various exclusion criteria, that delineation is done using technology and to ensure that there is better targeting. eShram portal, there are more than 400 occupations that are now listed, and this brings the basic social registry that Professor Desai was mentioning, that once you have them on the eShram portal, it becomes so much easier to push in at an appropriate time whenever you want. PM Kisan, I don't need to mention, but in PM Kisan also, the number of beneficiaries are better targeted, keeping in view the exclusion criteria that exists. Credit has always been a bugbear for micro entrepreneurs, and the PM Mudra and Kisan credits, 40 crore, that's what 400 million loans have been, number of loans that have been sanctioned. And all this is possible because of the saturation approach and the focus that whoever needs it should be able to get it. If you look at the 60 plus, then you have these pension schemes, which are on the unorganized sectors or for the small and marginal farmers. And you also have the senior citizen homes, so that people who are destitute can are out there, as also assisted living devices are given to them. And the National Social Assistance Program, obviously, is the volumes that I want to mention. All these I'm mentioning because very often one doesn't realize the kind of volume of effort that is done in the different programs and the numbers that we are talking about when we are implementing. Building resilience is, of course, a very, very important part. And Ayushman Bharat, we have about, the target is to have about 50 crore Ayushman card beneficiaries. We also have these Jan Aushadhi Kendras, where generic medicines are being given, which are very often 50 to 90% cheaper. And the jam trinity of Jan Dhan, Aadhaar, and mobile is what is enabling the DBT and ensuring that even during COVID, funds could be transferred to people who needed it. And I think Aadhaar, the sense of identity that it provides in terms of empowerment, needs to be recognized. And then, of course, you have the minimum housing that needs to be there, and on digitization of land records, which will help collateral if required. On risks is one area which was mentioned, and I'm not getting into the details, but there are for risk insurance for crop losses, for the accidental insurance, for the death insurance, and of course, on a longer basis, on what kind of longer disaster resilience work that is done, which is, of course, in terms of the national cyclone risk and, of course, the Green India mission. Just to mention that, I mentioned about the life cycle approach, and also the fact that now we are at a stage where we can talk of looking at different groups within, whether it's in terms of age, whether it's in terms of gender, whether it's in terms of occupations, where there would be more vulnerable people, whether it's in terms of the geography, whether it's in terms of special needs, and of course, those in economic factors. And in all this, I have not mentioned some important areas where basic needs are being focused, whether it's the Jal Jeevan Mission, where more than 11 crore households have got tap connections, the Swachh Bharat Abhiyan on toilets, the PM Ujjwala, which is focusing on LPG connections and improved cooking fuel, and Saubhagya Yojana on complete electrification of houses. At the end, just two things which I would like to mention. One is that most schemes, in a way, have evaluation system by that the schemes are approved only for 5 years. And after 5 years, there's a relook at what needs to be done and ensuring whether the targeting is right or not. We call it the Expenditure Finance Committee system that we have, the EFC, which ensures that in blocks of 5 years is what the approval is given for. And I think in a way, if I can put it, we are at a stage where we are looking at now working at the production frontier, so to say. We are looking at, we are not looking at basic issues of survival or of poverty, but looking at how to improve better targeting, better focusing, ensuring that no one gets left behind. And if you look at what the social sector spending is, we have already crossed 8.3%. The BRICS nations have somewhere around 10 to 11%. And I'm sure with the continued focus of researchers like Dr. Desai, our programs will only increase when we are talking of moving towards a Viksit Bharat 2047. Thank you so much.
Thank you, Dr. Subhas Garg. I think what you did was that you highlighted some of the findings of the household consumption survey data, particularly increase in the monthly per capita expenditure and also the reduction in unemployment based on, of course, the PLFS data, corroborating the findings of Dr. Desai that the poverty has declined. Then you try to highlight a large number of schemes which are being implemented, starting from early life up to 6 years, 6 to 18 years and others, and also many of those schemes like PM Jan Dhan, then LPG, PM Ujjwala and all that. All these improve in reducing poverty and providing certain necessities of life. Also, the significant part was that there is an effort to better targeting of the beneficiaries. And since, of course, many of the schemes are based on those who are poor, in the sense that, of course, nowadays the BPL families, it is very difficult to identify. Of course, it keeps on changing and there are variation among the states. In some cases, of course, we are using the SECC data, which is not at all accurate. But the significant part is there is an effort, or the approach is to cover all those who are eligible, irrespective of whether they are in a particular list like LPG cylinder and many of those things. So that to some extent takes care of the issues raised by Professor Desai, and you have brought out some of the aspects. Now may I request Professor Devarajan to make his presentation.
Okay, thank you very much. It's a pleasure to be here, especially to listen to Sonalde Desai's really very interesting discussion of this paper, and also to see friends, including friends in Washington, D.C., who I don't see there, but I come to Delhi and they're all here. So in this 15 minutes, I want to just make 5 points, and in some ways complement what Saurabh did, because Saurabh drilled deeper into the Indian situation. I want to spread out and talk about the comparison with other countries and the international context of poverty reduction and safety nets. So the first thing is the point that Sonal made, which is, and several other people have made, which is that extreme poverty has declined quite dramatically in India, and the people who are near the poverty line has been a substantial part of it, because these are the people who moved out of poverty. That's reflected in the world as a whole. So if you look at the developing world as a whole, the share of people living in extreme poverty, using the international poverty line, is actually 8%. So now, part of that is because India is such a big part of the world, but part of that is that this is a phenomenon that is happening quite in widespread. And similarly, if you look at a higher poverty line, so we now have, in addition to the $2.15, which is the extreme poverty line, we have a $3.65, which is a little bit like your near poor. That number is about 30% or 25% in the world. So that is now a substantial difference between the people who are living in extreme poverty and the people who are near poverty, the near poor. And if you want to go even further, there's an even higher poverty line, which is a $5 poverty line. Sorry, $6.25. I keep changing it. That's 50% of the world. And $6.50 is still no great shakes as a lifestyle, but keep in mind that the poverty agenda is not over. We're still fighting for it, and the people are in danger of falling below that line very quickly. So the pattern that Sonal and her colleagues evoked was actually reflective of the developing world as a whole, and there may be some way in which we can learn from each other in terms of how to deal with it. Now, having said that, I want to caution or qualify something that Sonal said about the fact that we should shift the focus from chronic poverty to vulnerability. And from a purely factual statement, that's correct. But I think it's a little dangerous, because that would mean that we focus on the people above the poverty line but below the double poverty line. The point is that the people even below the poverty line face these same accidents of life. In many ways, they face even greater accidents of life. But they don't get reflected in the poverty statistics because they're already poor. You see, so we have to be very careful, and this is what's pernicious about the head count poverty indicator, because it says everybody below the poverty line is equal, but we know they're not equal. And what happens is that when they get hit with a shock, they get even poorer. And this and just to give you some evidence of that, let's look at infectious diseases, because there was a mention of vulnerability. One of the vulnerabilities is that people get hit with COVID and other kinds of infectious diseases. The fact is that if you look at infectious diseases, they disproportionately affect the very poor, which is very different from non-communicable diseases, which are actually affect the rich even more. So these are just two examples from India and China that show that the incidence of communicable diseases is highly skewed towards the bottom 20% of the population. And these are some early data. I have students at Georgetown who complain whenever I cite a paper that was published before they were born. So I looked up recently and I found that you have the same pattern with a more recent statistics of India, that infectious diseases are disproportionately affect the poor, and by contrast, the cardiovascular diseases, for instance, disproportionately affect the rich. So that's, this pattern is preserved. And I think that this is important because, or this came to me, because there's also these studies now showing the effect of COVID-19 on poverty. And there's a report by the World Bank that showed that something like 80% of the increase in poverty happened, due to COVID-19, happened in South Asia, right? Now, I was working on a project on the impact of COVID in sub-Saharan Africa, and I saw devastation. And I was saying, how can this be? Well, the fact is that the people in Africa were already poor. They became more poor as a result of COVID. But that didn't come up in this headcount poverty indicator, because in India you had fewer people who were already poor, and you had a lot of people who were in the vulnerable category who fell into poverty. But we can't forget, and that's why I would say that we need to be looking at this concept of depth of poverty, which is the distance from the poverty line. That's another way to measure poverty. And that's what's actually going on, is when the people get hit with shocks, they move further away from the poverty line. And that needs to be picked up in the statistics. We can't neglect it. Okay, then the third point is to extend what Sonal talked about, and Saurabh also picked up on this, is to elaborate our measures of poverty by including public programs, subsidies, and others. And they did something with the food subsidies in India in the paper. But actually, there's some interesting new work that shows that you can actually do this for other public goods as well, because those, the government spends on public goods actually can improve people's welfare and should be incorporated in poverty calculations. And there's a recent paper by Guettin in Paris School of Economics where he's done this at the global level. So the one thing you notice is that at the global level, you've had a huge increase in public spending across the world. And all of these other measures that are also affect welfare and should be incorporated in our poverty calculations. And then he's gone and done something that is very clever but controversial, because you have to make lots of assumptions to do it. He's actually tried to then look at what incorporating this means for the reduction in global poverty. So he's recalculated global poverty indices, incorporating these public goods. And you find, not surprisingly, that the reduction in global poverty is even steeper than what we found before. It's a reduction since 1980 of 90%, and whereas previously it was like 77% without incorporating these measures. So if Guettin can do it for the world, I'm sure we can try to do something for India as well. Again, keeping in mind that you got to make a lot of heroic assumptions in getting there, but it is important to keep that in mind. Okay, then the fourth one is that Sonal's point about some of these safety net programs are actually having an impact on income distribution, a pro-poor impact on income distribution, and therefore there's some allusions in the paper to maybe we should consider scaling up these programs. And that's also something that comes up in public policy discussions, that when we have a program that we can show has improved the distribution of income, we should think about scaling it up. But there too, I think we should be very careful, because we also have to look at what happens to the financing of these programs and what that does to the distribution of income, because these programs all have to be financed. And if you look at the incidence of taxation, which is what they effectively are being financed by, it's sometimes not very good news. So there have been some studies. So there's one set of studies for rich countries, for OECD countries, that look at what they call market income, that is the actual incomes before taxes and transfers, and look at the distribution, the Gini coefficient. And then they compare that to disposable income, which is market income less taxes plus transfers. And you find that in these OECD countries, there's a substantial reduction in the Gini. So it's an improvement in distribution of income when you take into account the taxes and transfers. But then you compare that to developing countries, and the news is not good. In the sample of developing countries, with the exception of South Africa, which of course has the highest Gini in the world, there's almost no change when you incorporate taxes and transfers together. So you go through this whole rigmarole of collecting taxes, and then you transfer it, and you end up where you started from. This is very distressing, right? So that if you advocate for all of these programs to scale up, and then you find that you're actually taxing the poor in order to finance programs for the poor, what does that leave you with? And I just checked again for more recent data, and there's a very interesting project by Nora Lustig, some of you may know about it, the Commitment to Equity, where she has, they have done for a large number of countries, although interestingly not India, looking at, and one of the questions they look at is, at what point in the income distribution do people become net payers into the fiscal system? So that's what they receive less what they're paying out. And for the bottom, for Uganda, Tanzania, Nicaragua, and Ghana, the poor, the ultra poor, as she calls it, the people between $0 and $1.25 a day, are net payers into the system. And for middle income countries like Sri Lanka, my country, it's the third quintile that becomes a net payer into the system. So we've got a problem in the incidence of the tax system, and we have to do something about that if we want to scale up these expenditure programs. Okay, finally, last point is that there is mention in the paper, although not in the presentation, about the potential for these programs to be captured. The political capture of social safety net programs is actually quite widespread. I don't have time for both, so let me give you the example from Sri Lanka, my own country, so you can blame me. Sri Lanka has this flagship program called Samurdhi, and Sri Lanka is considered one of these success stories in social policy and overall. And it transfers about 1% of GDP to poor households. And the eligibility was set at 1/3 of the poverty line. But what they found was about 50% of households in Sri Lanka were receiving Samurdhi payments. And the errors of exclusion and inclusion were rampant. So you had something like 30%, only 30% of Samurdhi payments went to the poorest quintile of the population. And by the way, the poverty rate at that time was about 20%. So this is the poor, got only 30%. Furthermore, of the poor, only 63% actually received Samurdhi payments. so that there were both errors of inclusion and exclusion. Now, how can this be? And this is supposed to be Sri Lanka. This is supposed to be a sophisticated social policy program and everything else. Well, there's some studies that looked at who received Samruddhi payments and correlated that with whom they voted for in the previous election. The party in power at that time was the PA, the People's Alliance. And if the district voted between 40 and 60% for the PA, that's the ones who got the highest Samruddhi payments. If they were below 40%, they didn't bother with them. And if they were above 60% also, there was not much point, regardless of how poor they were. And again, you might think this is, I'm talking about something that happened 10, 15 years ago. Just literally 2 days ago, I was reading in the newspaper, it's election season in Sri Lanka. The party with the majority in parliament, the Rajapaksa party, if you want to call it that, was organizing a rally of supporters for the election. And they told people, poor people, if you don't attend the rally, you risk losing your Samruddhi payments. Explicitly. So this is going on today in one of the better programs. So let's actually pay very close attention to the potential for political capture in all of our social programs. Thank you.
Thank you, Professor Devarajan, for a very interesting presentation. In fact, initially you showed how if the poverty level, we have a higher level of poverty line, then the percentage of people who are poor, of course, increases. That, of course, is bound to happen. But your focus on vulnerability, that is extremely important, and that is very relevant in the context of Professor Desai's presentation also, in the sense that people from chronic poverty, they can go above the poverty line, but they can again come back to that because they are more vulnerable. And as you rightly said, that people who are chronically poor, they are more vulnerable. That's a very important thing we must remember. Then, of course, you talked about the shift should be there in social protection to the vulnerable, along with, of course, those who are chronically poor. And the overall incidence of government program, of course, you said slightly pro-poor. So, and the possibility of political capture, as Saurabh pointed out, possibly if the focus is on, if there is a focus to have universalized benefits or to have a saturation effort, then probably to this, some extent this can be reduced. And also technology, I think if it can lead to better targeting, as in India, and Mr. Nilekani knows it better than others, that how the technology has changed the way benefits are actually delivered. So these are some of the ideas. Now we have some time for comments, queries, and from the participants. Yes, last. Please tell your name and also, if possible, your background very briefly, and then, of course, the question. And also, if you can indicate whom would you like the response to be given.
Sure. Thank you, Mr. Mishra. My name is Ratna Sahai, and I'm a professor here at NCAER. I used to be at the IMF for all my career. I'm also at a think tank in Washington, D.C. So, my background is basically I'm a macroeconomist, so I like to ask the big picture questions. So the first, I just have two comments. One is in question. One is for Sonal. Let me say the presentation was great. I loved the comments also from the discussants and yourself, Mr. Mishra. Very enlightening. It's not my area, but from the macro perspective, the question that comes to my mind is, India is a high growth story, relatively speaking. So I want to know, of the three competing hypotheses, very convincingly you showed that poverty has fallen quite a lot. And I want to know whether, do you think it's because the high growth and there's a trickle down, so that's one aspect of why poverty might decline. A second aspect that we focused a lot on, which was just purely an increase in social spending, and we see a lot of that has been happening. But a third factor that the discussants spoke more about, and I think we need to pay more attention to that, is the government has also spent on infrastructure, where we know electricity, water, road transport makes a huge difference to the poor. And how does that feature in? That's one aspect. The other is that, and I worked a lot in this area, which is technology and financial inclusion. And with Aadhaar and, Jan Dhan Yojana, how much has that contributed? So of these three competing kind of factors, where would you say, I know your work hasn't focused on it in this sense, but it would be great to know, just your intuition or what your sense is, what really has made the big difference. Because the third aspect is about also efficiency in the use of spending. And I'm very much with Shanta on not just trying to increase the spending, but social spending, because it has to be kind of financed. And Shanta, so one of the points that I wanted to make, and let's see what you have to say, which I find shocking in many countries, including my own, which is India, is talking about the facts that you showed about, very interesting, about the market income versus the net of taxes and transfers. I mean, in the Indian case, and I think it's true about South Asia, I don't know why the rich farmers are not taxed. It's a huge set of people. They really should be taxed. I mean, I know there's some political economy stuff, but it's high time. So let me stop there.
More questions, so 3 questions we can take together. Yes.
Dr. Desai, it's an excellent paper. I enjoyed listening to you.
Could you introduce for the audience?
Yeah, my name is Govinda Rao. I'm a counselor at Takshashila Institution, Bangalore. I used to be the director of NCAER earlier. One of the entire thing in the dynamics of change and transition to poverty that you have alluded to, a policy question that comes is it possible from your data that you have to chart out the contribution of short-term palliatives as compared to long-term empowerment issues like education and healthcare? Is it, from the data that you have, is it possible to make that? That would make a significant policy contribution to say that, look, this short-term palliatives is not the way forward, is the long-term empowerment that is that's important. Thank you.
Thank you, Professor Desai. That was a fantastic presentation. My name is Shekhar Iyer. I'm with Johns Hopkins University and also with NCAER. One clarifying question I had, which went a bit, I guess, to what Shanta was saying. Your analysis is in terms of the Tendulkar poverty line. How does the Tendulkar poverty line line up with the $2.15 purchasing power parity international poverty line of the World Bank? Is it higher? Is it lower? The other thing I was really struck by was that over the 3 waves of the survey, it seems to me that rural poverty has fallen much more than urban poverty, to the point where they are both about 8.5% today. What is the reason that rural poverty has fallen so much faster? And what might be the consequences of this, for example, in terms of rural-urban migration? One often thinks of these phenomenon as reflecting income or poverty differences, but if in fact poverty is now equal in rural and urban areas, what are the consequences?
Let us, I think, respond to these three questions, then I will go to some more questions.
First of all, I just want to thank the two discussants. Excellent point. And I think, Shanta, I'm glad you sort of pulled me up on the fact that, the poor are also very poor and they shouldn't be ignored in a focus on the transient poverty. So that truly was a remarkable comment, and I think it's well taken. To start to respond to the various questions, Ratna, I think that I suspect what leads to economic growth is a question that there are many more people in this room who are far more qualified to answer than I am. I do not believe, though, that the poverty decline can take place just by social programs. Okay, social safety nets are not designed to reduce poverty. They are designed to provide a protection against descent into despair. Okay. So I think that that's basically where I came from when I was sort of thinking about the social programs and so on. Your comment on rich farmer, I have to tell you, I have now done enormous amount of field work in rural India, and I don't believe that rich farmer as a class exists anymore. Okay? Basically, the land sizes have become much smaller. Farmers have gotten richer. Okay, but not because of the land ownership or agricultural production, but as much as the fact that they are also participating in non-agricultural activities. And those are sort of the things that are leading to income growth in the rural areas. Okay, so I guess, do we want to tax farm income or do we want to tax higher income earners is a separate story. Okay. On Professor Govinda Rao's point, short-term palliatives versus long-term empowerment, I don't think there can ever be a question that it's the long-term economic growth that is most important, right? But the short-term palliatives can be necessary in cases where people could fall into absolute misery and poverty. Clearly, I think India's example during pandemic is fantastic, okay? We actually had a survey going on at NCAER, which had started just before pandemic, and we continued it right after pandemic. On one of the things we were doing was looking at food consumption. And actually, in spite of the severe economic decline, the food consumption did not go down, which actually is quite a tribute to the food distribution programs that were sort of put in place. Shekhar, Tendulkar line is actually lower than the World Bank line. Okay. At this point in time, it's roughly adjusted for 2024 prices. It varies for urban and rural areas, but it's like 1,600 and 1,900 per person per month in terms of rupees, so it's lower. Okay. But I use it because that's the national poverty line, that's the last one we had used in the past. Rural versus urban, and here I'm totally puzzled. I don't have a good answer, okay? I have to tell you, I went and calculated and recalculated my data umpteen number of times because I didn't believe it, okay? How can you believe that the rural, but let me go back to the old story of the poverty line, okay? Remember, we had the Lakdawala poverty line, okay, which actually showed urban and rural poverty more or less in tandem, okay? Tendulkar went and said, no, we can't believe that the rural poverty is about the same as the urban poverty line, so let's leave urban poverty line where it is and increase the rural poverty line, okay? And now it seems, again, we are sort of getting closer in terms of the numbers, including the HCES, the NSS data, okay? So I suspect there are a number of issues involved, and again, there are people with greater expertise than me on that topic, but some of it has to do with prices and consumption basket. So my expectation is that some of that might get fixed over time. Okay. Some of it, though, is also that we have historically thought about poverty in a rural context. And yet, there is a tremendous amount of vulnerability in urban India. People who are sort of leaving rural areas and migrating to urban areas also fall into some of the deeper poverty. So it may be that in urban areas, we have both more rich people, but also a reasonable number of poor people. Okay? And so I think this is something that requires greater examination. You have definitely hit the nail on something that I have been puzzled about. Okay? My guess is that we'll be putting out this data in public domain. There will be many, many answers that people will be sort of coming up with. Okay? But I would actually want to re-estimate it with a redesigned price indices.
Yeah, but the household consumption expenditure survey, doesn't it throw some light on this? Because there it shows that the monthly per capita expenditure increase in the real terms, 40% for rural areas and 33% for urban areas. And the rural-urban divide also declined. So how do you, so doesn't it give some indication?
I agree. I mean, I think that both surveys are showing a similar trend. Okay, I would like to see at least a little bit better understanding, or for our data at least, on the price indices, because there may be some issues involved with that one. But I also think that that actually HCES data at least speaks to the fact that there may also be, while rural incomes have grown, there may also be a segment of poorer people within urban areas, bringing the gap
so
sort of
that
closer.
is one more reason. Of course, I am not sure, but it could be that many of our social safety net, social program and even development program, they are much better organized for the rural areas than urban areas. For example, health system, any of those. So that could be one way possibly, but this should depend on the data.
Thank you. Just to quick, with Ratna's question, absolutely. We are way undertaxing the ultra-rich. And that's one of the reasons for this attempt to try to bring in a wealth tax that Gabriel Zucman is running all over the world trying to introduce. As you said, there are political economy obstacles, but there are also coordination problems. You can't, one country can't introduce a wealth tax because the Gerard Depardieu types will move to the neighboring country. So you do need that coordination. But you're absolutely right. This is a hugely undertaxed segment, particularly property taxes and things like that. Just quick point about what Govinda said. I want to comment on that because, you know, using the term short-term palliatives already gives it it demeans it. What this is the social protection programs are there to smooth fluctuations. That people are faced with shocks all the time, in terms of trade shocks, health shocks, and so on. And a good social protection program would smooth that. And that turns out to be very important. This came home to me once when I was working on Africa. You take two countries, Tanzania and Rwanda, more or less the same per capita income. They had the same growth rate over a 10-year period. Rwanda reduced poverty by something like 10 percentage points, Tanzania by 0, right? How can this be? Well, it turns out that both of these countries are subject to huge fluctuations in terms of trade shocks and things like that. And Rwanda has a system, a social protection system, that is automatic. It kicks in as soon as there's a shock. They start transferring resources. Tanzania, you got to go through a whole rigmarole through Parliament and everybody else and the World Bank, and they have a very ineffective social protection system. So this is critical. It's not just short-term palliatives. This is actually insurance that we're trying to provide. And just one quick comment on Shekhar's last point. He said in passing, what does this diminishing rural-urban gap do to migration? Well, the evidence turns out that out-migration increases with per capita income. So this might actually increase migration, rural-urban migration. Up to a point, that seems to be the evidence around the world. That if you're really, really poor, you don't have the connections to do the migration. As your incomes grow, you start having potential to migrate.
Thank you, Chair. Firstly, my apologies that the traffic patterns prevented me from listening to Sonal, but I have direct access to her, so I was pleased to be here for the comments. And secondly, two other comments. One is very pleased and proud to see Niti Aayog on the banner, particularly since I had nothing to do with it. And let me just point out to those in the audience what an act of generosity and commitment it is that the Principal Secretary at this time has devoted time to this. I only have this, a scant sense of quite how busy it is. So your patronage of ideas, Dr. Mishra, which I'm aware of, is greatly appreciated. But just three quick comments. Particularly since we've got Shanta, ex-World Bank, Auguste here as well, and most importantly, Secretary Mosby. So, as you know, India has been very wedded to the idea that we measure poverty and welfare on the basis of consumption. My sense is that going back to the LSMS, and God knows how that was, the bank, basically felt that income was a concept that could be measured. And so whether you have any thoughts on what ought to be the glide path to go from consumption to income, and whether there's information that's lost along the way, I think would be important, because we are also attempting, as I understand it, to compare our consumption poverty line with an income poverty line. Is that right? Or all the global poverty lines, consumption lines? I'm not sure. Okay, so that's just an issue. Since we've got Secretary Mosby and Principal Secretary here, I, sort of pleaded for this when I was a part-time member of the Statistical Commission. The second, which comes back to your point, Shanta, and it's of course also been remarked on in the Piketty et al. More recent work on income distribution. So exactly what kind of tax data should be in the public domain for what public policy purposes? Because presumably these, neuralistic numbers essentially come from some data on the incidence of indirect taxes. Now, is it important that that be tax data, or does that actually come from the household side? So two kind of data-related questions. Thanks.
Thank you, sir. Lata Venkatesh, CNBC consulting editor and now visiting faculty at NCAER.
Speak a bit louder, I think.
Yeah, sure. Okay, I think I can be heard anyway. Thank you very much. Yeah, visiting faculty NCAER, yes. Excellent papers. Thank you very much. Dr. Desai, I wanted to ask you why, in fact, everybody, have you all not included electricity? Free electricity is a charge against many political parties, but I would assume that it allows a child to study at home if there's an electric bulb. It improves productivity of the parents if there is a fan at home, given these days. So is that included? And if not, I didn't see it in your table. And secondly, is the difference in rural, steeper fall in poverty in the rural areas because of MNREGS, since it's a rights-based program? And if you can tell me exactly what is the prescriptive nature which needs to be corrected, then it may perhaps be more useful to keep that program going. Thanks.
Okay, can you hear me? Yeah. Thanks, Sam Asher, Imperial College London and NCAER. And thank you, Sonal. So exciting to see the results starting to come out from IHDS 3. A comment leading into a question. I think you highlighted rightly that churn in and out of poverty is a big source of mistargeting when it comes to the eligibility of benefits when using a poverty census like SECC to determine who gets access to these benefits. I think another major one is that assets are, of course, an imperfect proxy for actual poverty and vulnerability and the need for these things. So I'd love to get the thoughts from Sonal, but actually really from everyone on the dais, about the prospect of using government administrative data to better target a lot of these benefits, and it could be different for different types of schemes. But it really seems that in the era of Aadhaar and of linked accounts and everything else that the government now knows about people's economic status, that actually we're getting close to the ability of government to do a much better job at much higher frequency of targeting programs based on other measures of both income and vulnerability. Thank you.
Devesh Kapoor, like from Johns Hopkins. The best safety net a person can have is a good formal sector job. Is the growth of India's safety nets a sign of India's success or a sign of India's failures?
This side, yeah. 3 questions this side.
So, my name is Raj Shekhar Joshi. I am Vice Chairman of Setu Ayog, that is the erstwhile State Planning Commission of Uttarakhand, and it's like Niti Ayog for the state. Having worked for more than 3 decades in the corporate sector post my IIT and spending time on public policy and corporate, so finally I run this commission, which is there in Uttarakhand. So I have developed a good understanding of what's happening in my state, as well as seen Maharashtra and Uttar Pradesh also quite closely. So 3 observations, especially for Sri Saurabh. I see clearly a very big focus on schemes. It's a very supply side focus, which is there, and a lot of things happening, often duplication, and often so that's one part which is there. The whole thing runs around the schemes. The second part is the how to strengthen the what is the effort on strengthening the state capacity, because India cannot grow unless the states grow and the state governance improves substantially, which is there. I think there is the capacity of the Indian state down the line, which is there. I deal with Gram Pradhans, Gram Sabhas a lot. The understanding the schemes, the plethora of schemes which is there at the ground level, have people got a good understanding of those schemes itself, knowledge itself in the first place. And also the capacity of the Gram Pradhans, Gram Sabhas, because they are a big focus, the Panchayati Raj institutions. I think that's an area where from a supply side focus, sort of balance towards the demand side, which is there, how to make it more effective. So any thoughts on that? Any plans on that? Because unless you do that, and of course I intend to have a dialogue with Professor Karthik Muralidharan, quite impressed with many of his thoughts on the effectiveness in the Indian state, especially at the lower strata. So I'd like to hear something from Shri Saurabh on that.
Yeah, I guess that's I am Professor Karthik Muralidharan and with UC San Diego and NCAER. So actually, I'll make it very quick, in fact, because Sam asked a key part of what I was going to ask. So I think, Sonal, thank you so much, because what you've shown is something that most of us have suspected. But we have 2 fundamental problems with poverty targeting, right? So one is poverty is continuous and not like a 0-1, as Shanta alluded to. The second is it's dynamic and not static. And most of our targeting kind of relies on one-off measurements happen, say, every 10 years. So I think the long-term steady state, if you think about high-income societies where everybody files taxes regardless of whether you pay or not, that means the government has continuous visibility on annual fluctuations, right? And you have automatic stabilizers so that the schemes and the support responds to the shocks that people are encountering. So we are going to be quite far from there. But like Sam said, And I think we're quite far from designing schemes that are dynamic, but if we can at least start analytical exercises, and this is really a question for Dr. Garg, because you've spanned all the key roles, right, between Aadhaar, social protection, MOSPI, and finance, to kind of saying, even as an analytical exercise, maybe starting with some states as pilots, to say, can we put together some measures of continuous deprivation that is able to then track both kind of continuous at a point in time and dynamic over a period of time, and then just use that to then run certain simulations on what kind of a dynamic social protection net would look like. So I don't think we know enough yet to design those policies, but as a research enterprise, I think that could be very useful.
Hello. Hi, my name is Prabhat Barnwal. I'm an associate professor in economics at Michigan State University. I have been working on some of these subsidies things for last about a decade. So first comment I have is that in addition to the programs which are running, we should also have a look back to programs which have been successfully run and like we targeted people out of those programs. So one very important example is LPG subsidies, where like Nilekani committee report about like I think 12, 13 years back prescribed 3 steps, and then the Ministry of Petroleum implemented it, and the Aadhaar played a big role. And now it is being targeted only to the poor households. So I think this is also important for us to look at those programs which have like where we have seen people graduated out of the program over the time, though there are like some like bouncing back on those LPG subsidies as we are seeing in the recent time. Second point I have is that these 3 waves have coincided really well with India's investment in Aadhaar, and bank accounts, etc. Especially the first 2 waves were almost before this new system came into being, and the third wave is like providing us a 10 year, about 10 year end line after this. So it will be very good to know, Professor Desai, if you have also data on like when households got Aadhaar or when they got bank account, and one can look at the exposure to Aadhaar and bank account and how that translated into reduction in poverty and improvement in household condition. And third point which captured my attention is that about NREGA and the South and North divide, which tells me that, if I understand it correctly, is that some states have fiscal buffer and fiscal capacity to basically address some sort of cycleness in like the funding for NREGA. It would also be good to know like if there are other programs which also either suffer or where some states are able to do better because they have complementary fiscal buffer or fiscal capacity to improve this program. Thank you very much.
Last question, I think this side there was a question. Yes, please, Mr. Manish, sir. The last question, then all the panelists will respond.
I wanted to react to your reaction to Govind's comment about insurance versus, short-term versus long-term. I mean, insurance can't cost us 10, 20, 12% of GDP. So obviously, it is a short-term palliative till we create formal jobs or stuff like that. And especially how you finance this social security really matters, right? I mean, do we finance it by debt or do we finance it by taxes? Because increasingly, if we shift the social security financing to states, many of them are bad ancestors in terms of stealing from your grandchildren or great-grandchildren now. So I think that we have to think about being good ancestors, and Social Security turns out the easiest way to be a bad ancestor, or not really. I'd love, because you're saying it's not a short-term palliative, it is, insurance is 2, 3, 4% of GDP. It's not reaching 8 or 10, or is it?
I think we'll start with Professor Devarajan, then Dr. Subhash Garg, and finally Professor Desai.
Okay, thanks. Really interesting questions. Well, let me take the last one about whether it's short-term palliative versus insurance. I think it's a question of design. I mean, the principle of social protection should be as insurance. We have unfortunately created systems that aren't insurance, they're just transfer payments. And that's where the 10% comes in. Now, it's not that I'm against transfer payments, but we have to be very careful whether that's what we are trying to achieve or we're trying to achieve insurance. And that's the problem. Now, actually this goes back to Devesh's question, I think. the reason we have transfer payments is, and maybe we should have more, is because we also have a whole set of inefficient subsidies in this economy. Fuel subsidies, energy subsidies, God knows what, right? Those are both inefficient. They distort prices, but they're also typically pro-rich. They don't affect the poor. I mean, think about electricity subsidies. Or somebody mentioned free electricity. I mean, let me tell you about free electricity. Who actually consumes electricity more? It's the people with air conditioners and washing machines. So we have caught in the system that we have developed where we confuse insurance with transfer payments with distortionary subsidies. If I could start with a blank slate, I would design a system where you have cash transfers instead of subsidies and an insurance system. The question about financing, I think we should keep those separate because financing of debt versus and taxation, that's a macroeconomic question. You go ask Ratna to take care of that one, because that should be for the whole system. You shouldn't earmark financing of the social protection system as separate from financing of public expenditures overall. That should be done at the economy-wide level. It's very dangerous to try to earmark particular types of public expenditures with particular financing schemes. I think, Suman asked this question. By the way, I'm not the only ex-bank here. There are like about a dozen of us, but it's okay. You can pick on me. The question of income versus consumption, there are two parts to it. I mean, one is from a purely conceptual point of view, consumption is a better measure of welfare. And the classic is you can have huge fluctuations in your income, but consumption is much smoother. There's the permanent income hypothesis and whatever. So you're capturing, since we're all trying to capture welfare, we're capturing consumption better. The point is that some governments, some countries choose to measure income as their way. By the way, from a data point of view, I would say measuring income is actually more difficult than measuring consumption. But nevertheless, they continue to do so. And then there's a huge process that goes on at the bank. I know Lant may have been involved in it as well, where because you get these estimates for hundreds of countries, and then you have to bring all of them down to one measure, which is consumption, and you try to normalize on that. I think that's the general approach now. I don't know if Auguste or Francisca wants to add to that.
I didn't mean to come in on this one because I'm not an expert, but I was just thinking that if you were to measure income, it would be challenging to ensure that we capture all the income that is coming from the informal sector in most economies. But thanks for bringing me in. And I also wanted to acknowledge the partnership with Poonam on today's IPF, and I hope we'll continue this partnership going forward. Thanks.
Thank you. I'll take some of the questions. On the expenditure and income, I think Shanta has already mentioned, but obviously we only do expenditure surveys and there's no plan to do income surveys, apart from, I think, everyone is aware of, but there are obviously more possibilities of people not really talking about their real incomes when a survey is done, and the possibilities of, but I won't get into that debate, but we are focusing on expenditure surveys only. On Lata's point on free electricity, I think I mentioned in this HCES for the first time we looked at imputed income based on certain figures for food and non-food items. Health and education I mentioned we didn't figure. Electricity, number one, there's been a lot of variation across states. It's not been a constant. In some states, it has now started. So to that extent, our consumption expenditures are conservative, absolutely. But I think in the interest of being more credible and more sure, I think that's what we've been doing. But going forward, we will look at what other imputations we need to do. On Sam's point of administrative data, absolutely on the point. That's one of our focus areas because we have administrative data which is much more current. The only problem is that it's embedded within departments and ministries, and we need to pull it out and ensure that the issue very often is in terms of its uniformity. And I think that's the issue that we're trying to look at and see which of the administrative data can become core statistics. And on the issue of supplies, I think the schemes which are formulated are always based on certain inputs or certain gaps that are seen. Just to give an example, we had this Palna scheme in Mission Shakti, which is on creches, and that's flown out of the LFS survey, PLFS survey that we do, which showed that in areas where women, even rural women, had access to creches, it improves So I think schemes are demands, are reactions to demands intervention. So I won't say it's entirely a supply side without any looking at on the demand side. And I think the other point which I made is that every 5 years there's an evaluation of what's been the impact. And I think that's very important to consider. On state capacity, just like to give one or two examples. NRLM, I think, is a great example of how the scheme ensured capacity at the ground level in terms of the Satnis and the cluster level resource people at the ground level to form self-help groups. The Capacity Building Commission is focused on looking at what kind of trainings need to be done, not only at the center but at the states. But I think capacity building is a continuous issue, which I think Karthik has already mentioned about. On this continuous deprivation, I think a lot of work is also being done in looking at focused on ultra poor, for example, in aspirational districts, and there are programs in Chhattisgarh and Bihar which are focused on looking at focusing on the ultra poor, and I think that work is ongoing. On the impact, Dr. Banwal mentioned about state-wise variations and learnings from successful programs. I think, I can only confirm that, that's something which, as I mentioned, is the input which goes. And that's why you will see a number of states have top-ups of the central programs, which are based on local demands of what they feel. And the impact of the digital economy, I think there have been a recent study about a year back, I remember, on RBI had done an impact on digital economy, especially in terms of on the financial sector. And the access to people in terms of microcredits because of Aadhaar, because of the fact that you could have banking correspondence, I think that has started, but I totally agree the impact of the digital economy for the poor is something extremely high and extremely empowering of having a self-identity. There's anecdotal, I remember in Aadhaar when we did a survey, a poor person said that now that I have my Aadhaar, no one questioned me, who am I? I can say who am I just because I have that Aadhaar, and that's extremely empowering.
Just given that we must be running out of time, I'm going to try and stay brief. I think that there are two aspects of the various points that have been made. One is that can we identify what's happening to the society as a whole over time in terms of poverty, distribution, etc. Second issue is can we identify individuals who are poor and who should be targeted for specific benefits. So income versus consumption, that's actually a very interesting question. I look at the consumption outliers and I actually print out the things and I look at who are the people who have high consumption. Many of them are because of illness somebody fell sick in the house and you have high consumption, actually it should be vulnerability, but then consumption data is showing them up to be in sort of an upper income category. Okay? So if you're trying to identify who is poor, perhaps income is a more useful measure in spite of all the other issues involved in collecting that data. Same thing applies to using administrative data or sort of continuous monitoring data, tax data, etc. Just think about it this way. You can take any government program, based on it you can say that, okay, people are participating in these programs, so they must be poor. But the fact is that they probably are participating in it because they managed to get access to it. We want to monitor the quality of the program, and then you take actually participation in this program as a marker of their identification. There is clearly a whole lot of endogeneity going on here that we need to think about and sort of analyze it. Perhaps Karthik's idea is good, that at least think about doing it as on an experimental basis of what else we can do it. But frankly, the holy grail of proxy means test, okay? Maybe it would be time to think about abandoning it, okay? The final questions the sets were around the MG and REGS. So just on a very brief basis, okay? Basically, program was designed in such a way that 60% had to go to of the expenditure goes to labor, 40% goes to the materials component, and about 6% is supposed to be the administrative expenses. Okay. Now, when the money gets released from the center, the labor pool gets released much more quickly than the materials pool get released. So in many states, people, the contractors and whoever is doing the work is waiting for a long time to get paid on their materials components. Any state which is able to front the materials cost is able to get greater access to the program. The second issue has been, by definition, it's not supposed to take away any regular jobs. Now, really, you could actually have the Palna program and women be participating in providing the creche and childcare services, but they cannot be employed in it because that is supposed to be a regular employment, and hence MG and REGs cannot be used for it. So those extreme regulations that were put in place to ensure program couldn't be perverted, okay, and now have become somewhat of a zanjeer where the program is getting perverted because of those regulations. Thanks. I'll end here.
I think we have already gone beyond the time limit, so I won't have any concluding comments, but a few only observations. It has been an extremely interesting, insightful, and very, very relevant this presentation by Professor Desai, and also two discussants, and also the comments from the participants also is extremely valuable. The messages which come from all these, very briefly, that poverty has declined. There is no doubt, because not only Professor Desai's study, but others like household consumption expenditure and so on. There is, wage poverty declines, instead of chronic poverty, the transient poverty dominates. And in this dynamic situation, there are more challenges for policies, for programs, and how to address those. Another interesting thing came out that we shouldn't focus only on poverty, but also on vulnerability, because those who are not poor also, if they are vulnerable, they can become poor, even if for some time. There has been a lot of discussion in the literature on relative poverty versus absolute poverty. Possibly we now, I think 3-4 decades ago, we thought we should focus on absolute poverty, but now it is time that we should talk about relative poverty, as it was brought out that different poverty lines and so on. But in this context, vulnerability issues need to be addressed, and particularly in the recent, now that the climate change and some phenomena like, even though some call it a black swan event like the pandemic, which can again occur, it may not be black swan event, but we need to address those. another concept was the net receiver versus net payers. That was also a very interesting idea which came, that if poor people have to pay more than they receive, that can go against their interest. The supply demand side and the state capacity, that is extremely important. In the case of Narega also, it has been studied that more money is spent not in the states which need it more, but the states which are better governed. They are able to utilize more. So in all these, we need to, of course, the implementation aspect is the most important, and the governance issues are the fundamental issues for success of any such program. To address all these, the last 1 decade, some of the initiative which has been taken is to universalize some of the basic social safety net programs, so that there is no question of identifying beneficiaries in a very rigid framework, but to give the benefit to people. Even if some cases non-poor get the benefit, at least it will address the issue of vulnerability also. So that is one approach. The other is use of technology that has, I think, changed the way we are able to deliver the benefit. The approach of the Government of India for the last few years has been, because originally the idea was Government of India formulate the policy and states implement, but now there is more focus on, and rightly also, on implementation aspect also, to ensure that to the extent feasible from Government of India side, that the benefits are actually delivered. Some of the aspect, not only like giving LPG gas cylinder to all the households who are eligible, but also geographical programs like the aspirational district program, where to focus on a particular district which are below average in some of the parameters. And that is a more focused way of reducing not only the vulnerability of people, but the vulnerability of the area. And there, one of the main elements is improving the governance of the district also. And public investment has phenomenally increased during the last few years, and that to some extent can help reducing poverty. If the road is constructed, if the water supply is there, I think that also helps indirectly reducing poverty. I think all these things have been highlighted by the discussants also. So with all this, I thank all of you. I thank Professor Desai, Saurabh Garg, Professor Devarajan, and all of you. And also I thank Dr. Poonam Gupta and NCAER for giving me an opportunity to interact with all of you on a different setting, away from the official work, but in a more academic and more intellectual atmosphere. I thank all of you. Thank you. Thank you.